For being with us this afternoon and for your continued coverage. Dr. Joe Cantor, as you can see, is here with me today. He'll be giving you an update in just a moment. I do want to start by addressing the news that LDH just released. So today we have confirmed Louisiana's second and third case of the UK COVID variant. And one of those was in Region 5. That's in southwest Louisiana. Centered around Lake Charles. The other was back in Region 1, the greater New Orleans area. We know that that variant is now in well over 20 states, and again, that's the third case here that we know of. There are 14 suspected cases that are still being evaluated by the CDC, and we'll let you know. But the bottom line is this variant is present in the United States. It is present in Louisiana, and we know that it transmits more easily. It's, I've heard 50% more easily transmitted, so it just bears discussion so that we know the importance. And by the way, we needed to be masking and distancing and doing all those things before, but it's even more critical that that happens. You may have seen where previously the variant identified first in Brazil had been discovered in the United States in Minnesota. And then today, the CDC also announced that the variant identified and associated with South Africa has now been confirmed to be in the United States. Now, to be clear, we haven't yet confirmed those variants in Louisiana. But we know that the way this disease progresses, that it's very likely that they will move across the country at some point. We also know that there's modeling to suggest that the UK variant could become the predominant strain of the virus in the United States in March. And so between now and then, it is essential that we do what we can to get the baseline numbers down that remain too high. We're going to go through some numbers in just a moment. But as it relates to the percentage of our tests coming back positive, as it relates to the number of cases developing every day, the number of hospitalizations, and deaths, all those baseline numbers are too high, and we need to get them down before this variant becomes predominant and potentially causes surges again. Surges unrelated this time potentially with a change in behavior, but just with a virus that is more easily transmitted. And of course, if that is accompanied by a change in behavior that also facilitates transmission, then we're going to be in a very, very bad place. Dr. Cantor is going to tell you more about this in a moment, but let me stress the take-home message. As LDH and I have said before, we all need to take this very, very seriously. And we see some improvements around the country. We see some improvements here in Louisiana. But we're in a very difficult place because of the very high level of our numbers right now. And these variants are very concerning. And we know that they are more contagious. We don't yet know whether they are more virulent, meaning that if you get the disease, you're more likely to have a serious case that requires hospitalization, or you're more likely to die. They're still gathering evidence on that. And they're still gathering evidence with respect to the effectiveness of the vaccine on those variants, although I've heard, at least as it relates to the UK variant, that the manufacturers of the vaccine believe that the vaccine will be effective. I hope and pray that that is the case. Also, I did want to announce today that General Keith Waddell, the Adjutant General of the Louisiana National Guard, has announced that he tested positive for COVID-19. He is working remotely while he isolates at home, and certainly I'll be keeping him in my prayers. He does just tremendous work for the state of Louisiana. And has for many, many years. But since becoming the Adjutant General, if you just look at the disasters, the emergencies we've had to respond to, including COVID-19 and all of the things that we've had our National Guard engage with, including their normal missions. You know, we have well over 2,000 National Guardsmen deployed today to the Middle East. So he's been working extremely hard. I appreciate him and all of the folks affiliated with the National Guard. And so let's lift him up in prayer. And by the way, he is asymptomatic. I don't know if I said that, but as of now, he is. I mentioned a while ago we're in a precarious position with respect to COVID. The baseline numbers are too high, percent positivity, cases, hospitalizations, and the lagging indicator is deaths. And that's why even as our numbers have started to slowly improve in these other categories, the number of deaths really have not. And it is a staggering number of deaths that have accumulated over the course of the pandemic, and the numbers that we're announcing on a daily basis literally do take my breath away. Today we are reporting 2,517 new cases of COVID-19, and that is on 35,914 tests. Sadly, we're also reporting 55 new deaths. There are 1,590 patients in the hospital across the state of Louisiana because of COVID-19. 206 of them are on mechanical ventilators. The number of patients, just to relate to you kind of how high our baseline is, a few weeks ago I had in my last conversation with Dr. Burks, she indicated that our goal should be to get hospitalization down to 500 in the state of Louisiana. Well, we're more than 3 times that. And again, that's very taxing on our healthcare delivery system as it relates especially to staffing. So obviously we want to do everything we can to get that number down. So this this message that I'm about to give you is one that's very consistent to what we've been talking about here for 10 months or so, but you're hearing it from the White House task forces, whether it was the Trump White House or the Biden White House, and from CDC and everybody else. It really is imperative that we wear a mask, stay 6 feet from those who don't live with you, avoid gatherings, stay home when you're sick, wash your hands frequently, make sure that you're tested if you're exposed, protect the vulnerable. And if you are one of the vulnerable because of your age, which typically we say 65 and older, or if you have these comorbid health conditions that predispose you to a more serious course of the disease, should you get it, then make sure that you protect yourself. And that includes not going into any indoor space where one or more people are unmasked. And obviously, when it is your turn and the vaccine is available to you, please avail yourself of that opportunity. Get the vaccine. It is safe. It's effective. It is the only way we put this pandemic behind us. I want to take a moment to remind everyone who is currently eligible to get the vaccine. In Phase 1A, it was hospital personnel, nursing home and long-term care facility residents and staff, first responders, those individuals who are dealing with medical emergencies who can get vaccinated and then serve as vaccinators. And now that was Phase 1A. They remain eligible because this is not a light switch where we flip off one priority group and go to the next. They remain eligible, but also Phase 1B Tier 1. Those are people 70 years of age and older, health-related support personnel, providers and staff for outpatient, community care, urgent care, behavioral health, and dialysis clinics, home care providers, staff and recipients, dental providers and staff, and schools of allied health students, residents, and staff. The total number of doses administered to date, and I think this was pulled yesterday, is 397,371. So we're right at 400,000 doses administered, and the number of second doses, do you have that? 56? So 59,000 individuals have actually received their second dose as well. The total number of enrolled providers, so if you're an enrolled provider, that means that you've enrolled with the state and CDC, you've been approved and you can receive direct shipments of vaccine and you can administer vaccine. But the number of enrolled providers across the state of Louisiana is 1,918. That's a lot. That's a large number for a state our size, and that reflects the hard work done by the Department of Health early on to do that hard work that's necessary to have these enrolled providers in place so that as more vaccine becomes available over time, we have the providers that we can ship it to and they can administer, and all over the state of Louisiana is very, very helpful. Now, because we don't have enough vaccine yet, we don't have all of these providers engaged. This week, you may know that we're administering vaccine in all 64 parishes using 324 enrolled providers. Because of the increase in vaccine dose allocations that we're getting next week, and I'll get into that more in just a moment, we will have more than 400 enrolled providers next week administering vaccine doses across the state of Louisiana. So while nothing is perfect, and we certainly have a lot of work to do to improve our processes and become more efficient and so forth, I am very pleased with the progress that we are making and that we continue to make together. We still have a large demand for vaccine in the current eligible population, and we're going to stay with the current priority groups for now. And I don't have an announcement for when we're going to transition out of that, but obviously so long as your current group isn't sufficiently vaccinated, it doesn't make sense to move forward, because then you're not really prioritizing the groups. The CDC ranks Louisiana 16th as of today, I believe, among states for how well we've administered the vaccine, and really that's a function of vaccine utilizations, how quickly shots are getting into arms once we receive allocations, and that's a testament to the providers, the Department of Health, all of the partners out there who are helping to get shots in arms. But quite frankly, I'm not satisfied with that. I know that we can do better. And all the people who are working here in Louisiana know that we can do better as well. Our greatest challenge continues to be the amount of vaccine that's made available to us. But the good news is there's a 16% increase starting next week because we were basically flat for we were basically flat for 4 straight weeks and the amount of vaccine doses that we were receiving. We will get over 67,000 doses for next week, and that increase of 16% is with respect to Moderna, and that's going to be, I think, 67,350 doses. I'm sorry, that's the total amount, and 29,250 of those are Pfizer, 38,100 of those are Moderna. And all of the increase, that 16% increase, was with respect to Moderna. The Pfizer number is basically flat. On Tuesday, I was able to participate in the call with the White House on vaccine distribution. They obviously understand the need to both increase the doses that are being made available to the states, and we're happy that's happened, but they also understood the need to give us information further out about the doses that we would receive so that we can plan and then communicate that and coordinate that with all of these enrolled providers so that when the vaccine comes in, we're ready to execute at a very high level. And the good news was, in addition to the 16% increase we're going to have next week, we're now going to have 3 weeks of data relative to the amount of vaccine that we're going to be receiving, and we can take that into account as we do our planning. And up to now, we would get on Tuesday a preliminary number of what we could expect the following week. That gets confirmed on Thursday, and on Thursday you start placing your orders for that vaccine that's going to actually come on the following Monday, and then you have between Thursday and Monday to make sure the enrolled providers know exactly how much they're going to get. That's very, very tough to do. And the idea that we can have, at least as it relates to Pfizer and Moderna, 3 weeks of information relative to those allocations will really help us as we move forward. And then, of course, looking beyond that, we still, like the rest of the country and really the rest of the world, we anxiously await additional vaccines getting approved for use. And potentially the next one will come in several weeks. It'll be the Johnson & Johnson is most likely to come next, and they should be asking for an emergency use authorization in a couple or 3 weeks. That would be very helpful because that is a single-dose vaccine, much easier logistically because you administer it one time and then that individual is vaccinated completely. Today, the Department of Health updated the vaccine breakdowns by race, gender, age, and region. We haven't fixed all of the problems with respect to the data collection and what we're showing, but I'm very optimistic that we have in place what is necessary to have this improve greatly over the coming next week or two, and then we'll have a much better idea as it relates to race. We certainly can't address what we don't know, and so if there's inequity out there, we're not aware of it. But I do know that the Department of Health is working aggressively to address these data challenges, and again, I'm looking forward to tremendous improvement over the next week or two with respect to our visibility into that. Now I'm going to turn it over to Dr. Cantor. He's going to share more about what we know and also a little bit about what we don't know about the UK variant in our state. He's going to tell us what the department is doing to address some of these data reporting challenges that I just mentioned, and talk a little bit more about the COVID vaccine, and then I will come back up after he is finished. Dr. Cantor?
Thank you, Governor. Good afternoon, everyone. Hope everyone's having a good day so far. I'll share a little bit of additional information about where we are in terms of the pandemic and the spread of the virus. I'll talk about the variant, of course, talk about a vaccine update, and then I do want to spend some time discussing some myths that are out there that have been causing me to lose sleep, no question about that. So it definitely appears at this point that we've peaked in terms of viral transmission and are now going in the right trajectory, meaning the cases are coming down a little bit. I say that with a little bit of a caveat because trajectory is encouraging, but we're awfully high. We're still about as high, if not higher, than we were at the peak of the surge in July and August. So in terms of risk, what someone in the community should know, what their risk is of being exposed to COVID, it's still, I mean, in all things being equal, about as high as it's ever been in Louisiana. And that's really the message for families, is it's still a very risky environment. And as the governor had mentioned with regards to the amount of deaths that we report every day, we cannot accept as a new normal that we're going to be reporting anywhere from 40 to 80 new deaths every day. Today was 55. That cannot be something that we accept. That's reflective of the amount of risk and transmission that's happening out there. So very encouraged that our cases seem to be rounding the bend, so to say, and going in the right direction, although the level's very high. As of yesterday, we're now below 10% positivity. That number is 8.6%, which again is encouraging, but a very, very high number. I mean, anything above 5% is dire, and we're still well above that. Hospitalizations are likewise, we've stepped a little bit away from the cliff. You know, we were able to weather this past surge without completely overwhelming the hospitals, which is encouraging and really a testament to those healthcare providers who work so hard, but still very, very busy, no doubt. Looking forward, we have a rough road ahead, as the governor alluded to, and we are unfortunately confirming today 2 additional cases of the UK B117 variant. This is one case in the Region 1 or the Greater New Orleans area, which is where the first case was identified about a week or so ago, and a 3rd case in the Region 5 or Greater Lake Charles area. In addition to those 3 confirmed cases, as the governor said, we have 14 additional cases, 8 in Region 1, 6 in Region 5, that are pending confirmation in the CDC right now. We don't do a lot of genomic sequencing and surveillance in this country. That's been talked about before. Some European countries do a lot more than we do. That creates a iceberg type scenario where when you have 1 or 2 identified cases, that's the tip of the iceberg, and you know there is a mountain below that. So we should all assume that there is significantly more of this UK variant circulating in this state than has been confirmed to be identified so far. That's going to continue to spread. We anticipate those cases are going to grow. As the governor said, we anticipate, based on the CDC's projections, sometime in March, that the UK variant will be the dominant strand here. That means more transmission is ahead for us. This is very similar to the situation we found ourselves in the run-up to Christmas and New Year's. And folks will remember we had a very high level of cases coming off of Thanksgiving, and we knew it was a rough spot because looking ahead, we had the holidays, and we knew what was going to happen. That's exactly the point that we find ourselves in now. This variant is out there. We know it's spreading. It's going to continue to spread. And so we need to do everything we can now to set ourselves up for that. We got to gain as much yardage as we can while we have the cases going in the right direction, so that when the variant does take over and become the dominant strand in Louisiana and likely increases our cases again, that we've set ourselves up for as much mitigation as possible. So that's what the real ask for families now is, to do all you can now to prevent spread, not only to protect you and your family now, but also to set ourselves up for as much success possible for just down the road when we think this variant is going to become a much bigger challenge for us. We do believe it's more transmissible. It's questionable whether it's more virulent, more likely to make people sick. And we do believe at the moment that the Pfizer and Moderna vaccines are a good match for it. So it's about mitigating the spread at this point. I'll talk a little bit about where we are with the vaccine, and I'll share the latest updates in terms of how much we have in state, how much is coming to us. And it was encouraging to hear the announcement from the White House a couple days ago that we'll be getting a little bit more, both in this next week and we think for the few weeks after that. So it's 9,200 additional doses of Moderna that we'll be receiving. So next week's allocation, which again we'll place orders on tonight, it'll begin to ship over the weekend for arrivals starting on Monday, will be 29,250 doses of Pfizer. That number has been flat going back 3 weeks, and 38,100 doses of Moderna, which is where the additional comes into play. So that'll give us a total of 67,350 doses next week, as the governor mentioned. At the conclusion of this week, we will have sent to us for our in-state allocation as a total of 438,100 first doses, of which we have diverted 93,600 to the long-term care partnership, leaving 344,500 first doses for true in-state allocation. At the conclusion of next week, with those numbers, that will bring the total number to 505,450 first doses, minus that same 93,600 that got diverted to the long-term care program, leaving a total in-state distributed allocation of first doses at the end of next week of 411,850. I want to clarify a couple of parts that have been confusing over the past week. The CDC has a very nice vaccine tracker out there. You can look across the country and compare states and see how much is gotten. The numbers that they show for in-state distribution are inclusive of both first and second doses. The numbers that I've been sharing here, for simplicity's sake, are just first doses, because the way that I think about it, each first dose is someone new who's going to get eventually vaccinated. So, but the CDC does do both first and second doses. They also have a few-day lag from when that tracker gets updated. So folks will notice there's a little bit of a discrepancy between the numbers we've shared here and what's on that CDC tracker. That's really what is happening. They're showing both first and second doses, and with a little bit of a lag on that. As the governor had mentioned, we have our work cut out for us to improve the quality of our demographic data. It's not when we have greater than 50% unknown or other, it's hard to make any type of conclusions about racial breakdown. We will be doing that over the next couple weeks, no question. A big part of that is encouraging our vaccine providers to pay more attention to the data that gets entered. This is important data, and the only way we can address inequities, if they do exist, are to know about them and have eyes on them. So we're going to be reaching out to our vaccine partners more to encourage them to enter in quality information into those demographic fields. I want to spend, one more item to update on is the progress of the long-term care partnership program. So as of the last data that was posted to us in our Operation Warp Speed portal, there's been a total of 28,038 total doses administered in the long-term care partnership program. Overwhelming majority of those are in nursing homes. That breaks down to 19,149 in residents and 8,889 in staff. We are on track to complete the first round of vaccine administrations in nursing homes by February 8th. I want to move a little bit now and talk about some myths that I have heard shared with me over the past couple weeks, and they give me great concern because there's disinformation about these two vaccines that is hurting our effort. And you might ask yourself, why are we talking about this right now if demand so clearly exceeds supply of vaccine? And there are two reasons why it's important for me to talk about this right now. Number one, I've heard a couple examples brought to me the past week of individuals who had an opportunity to get the vaccine and did not because they bought into one of these myths, and that just breaks my heart. It really makes me sad when someone has the opportunity to get vaccinated and they don't because they don't have the right information at hand or for another reason. So I want to let people be empowered to make the best call for themselves. The second reason is because we're looking ahead to when we're going to have more supply. At some point in the near future, the Johnson & Johnson variety we expect to be authorized. You know, we'll be getting to the big type of mass events. We'll be extending eligibility once we have the supply to do so. And I want to set ourselves up so that people are ready, that no one misses a heartbeat in that. So I'm going to go through a few myths which I've heard expressed to me over the past week or two and talk about what the facts are in this. The first myth is that the messenger RNA technology of this vaccine is new. It is not. That is not true at all. And the messenger RNA technology has been around for years. In fact, we have used it in cancer therapeutics for years. Now, one of the differences, we've never produced these cancer therapeutics at the volume that we're going to need to produce these vaccines. But the technology has been there. In fact, there was research invested in following the SARS epidemic. SARS was a coronavirus too, to develop vaccines for a coronavirus, which led directly to where we are now. So the messenger RNA platform actually is something that's tried and true. Being able to use that, having the technology available to use that in a vaccine of this scale, that's an exciting new development. But the platform and the technology has been around, it's been studied, and it's a very safe way to deliver vaccines. The next myth that I would like to cover has to do with what type of symptoms or what happens to someone after they get a vaccine. You know, these vaccines cannot give you COVID. It is not possible. It is not possible for these Pfizer or Moderna vaccines to give someone COVID. There is no live virus involved in it at all. Some older types of vaccines used a virus as a host. One of the great things about these new vaccines is it does not rely on using a virus as the host of the vaccine, either a live virus or a dead virus. It's just a little bit of genetic material that happens to degrade in your body very quickly after it goes in. So it is not possible at all for someone to get COVID from the vaccine. Now, it does take some time for the vaccine to build efficacy, and you're not 100% protected the minute you get the shot. That's logical. So what you'll see in the news is someone might be exposed and contract COVID a day after the vaccine, but that's just because it takes a little bit of time for the vaccine to build efficacy, but it cannot give anyone COVID. What it does do is produce an immune response in your body. Gives your body just a taste of what the one part of the virus looks like showing a picture to say, hey, take a look at this person, remember this guy's face if you ever see him again. That's what the vaccine does, and your body recognizes that and starts going through the motions of building up your own antibodies. That's what makes people feel perhaps a little feverish, a little bit sore in the arm, a little run down the day after they get the vaccine. That's what I felt when I had both of my doses of the vaccine. That's not people getting coronavirus. That's just a natural immune response. It's your body telling you the vaccine's working. The next myth I'd like to cover is to talk about what really this mRNA material does. And this mRNA material actually never enters in the nucleus of the cell. The nucleus of the cell is the command center. It stays outside of the command center. It never gets integrated into someone's DNA. In fact, it actually degrades very, very quickly after entering in. All this mRNA material does is it basically is enough to show your body that mugshot, that picture of the person, say this is what the virus looks like, and then your body degrades it, and then it's gone. But your body already has seen it, so they're starting to make antibodies against that. It is not possible for this mRNA to get introduced into someone's genetic material or DNA. It never even enters the nucleus of the cell. That's one of the reasons why it's such an extremely safe virus. And the last myth that I'll talk about has to do particularly with women of childbearing age, and this is a really important one. And there is zero evidence that these vaccines have any impairment of a woman's fertility. And a couple people asked me this question this week, and I know it's an important question to ask. But there is absolutely no suggestion of evidence that these vaccines do anything to impair a woman's fertility. Women of childbearing age, if they are eligible to receive the vaccine, should 100% receive the vaccine. They're doing themselves a disservice if they do not out of this unfounded fear. There's absolutely no evidence, nor is there a plausible mechanism by which these vaccines would impair someone's fertility. So really, women of childbearing age, if and when they do have the opportunity to get vaccinated, should not pass up that opportunity at all. I think I'll stop right there and be happy to answer a few questions if there are any. Melinda?
Could you go through the numbers again on the long-term care partnership program? And can you talk about, that seems like a fairly low percentage of people who have been vaccinated so far based on the numbers we were previously given. Are you seeing, I know a lot of states have reported seeing complaints about the slowness of the CVS Walgreens participation. Can you just talk about that a little bit?
Yeah, the numbers were, and again, the program I'm pulling them from is on a few-day lag, so they're markedly higher now, no doubt. But those numbers were 28,038 total, broken down to 19,149 for residents and 8,889 for staff. No doubt. I think all of us would prefer that the program's going faster. I'm encouraged that the uptake rate amongst nursing home residents so far is about 69%. Which is fairly encouraging. The uptake on the staff has been lower. It's been about 26%, but we believe that when they go back for the second visit, they actually make 3 visits total to a nursing home. They make a first visit for the first dose, they make a second visit to do second doses for anyone that got it, and then offer first doses again for anyone who missed the first round, and then they go back for a third time to get those other second doses taken care of. We believe a lot more of the staff are going to take part and get that second dose when it comes. So I'm actually optimistic that that staff number goes up a little bit. I think they're doing, all in all, the program's going well in terms of it's getting good reviews. And when we hear from nursing homes that have been visited, and the majority of them have been visited at this point, they like the program and the residents like it. We all wish it was going faster, no question.
In terms of the February 8th deadline, that's just when they're going to stop making the visits at the various facilities. Is that right?
No, not going to stop. That's when they're going to finish. That's when the last remaining nursing home will have had the first visit, the first dose visit. And then the second dose visits are actually happening right now. and then there'll be third dose visits after that. So it's a rolling program. What I meant to say is by February 8th, every nursing home in the state will have had at least the first dose visit.
Okay, so people want, I guess I'm trying to figure out what happens if nursing home residents or staff decide later that they want vaccines. What will they have to do once CVS and Walgreens is sort of done making these visits?
There'll be opportunities. We haven't exactly figured out what that looks like, but there absolutely will, because the population of a nursing home is not 100% static. People come in and get discharged. So there will be opportunities. While we're still in the program, it's less important because they have that second visit opportunity to get it. But there'll be opportunities. We just haven't figured out exactly what that looks like. Sam?
The Biden administration said you guys would have a 3-week window into how many doses you're getting. You've given us the next week, but I'm wondering what the shipments are going to be for the 2 subsequent weeks. Are we still going to get that 16% bump above our baseline for those following weeks? And also, will this 3-week window mitigate the cancellation of appointments among providers? Because they cite largely the lack of information or lack of steady stream of information coming from the state or from the feds. So do you think that'll mitigate any canceled appointments moving forward?
Yeah, I think so. I think yes to all of those questions. We haven't actually been told definitively what those allotments 2 or 3 weeks out are going to be yet. I think they're going to be posted on the system that we look at sometime soon. We've been led to believe that number one, it's going to be relatively steady to what we had this week, which means that the 16% increase of the additional 9,000 or so, 9,200 Moderna is going to be baked into what we get for the next few weeks, which is encouraging. It just hasn't been 100% confirmed for us. And to the other question, I do. I mean, it's as the governor said, we're asking an awful lot of our providers. I mean, we're asking them to, with really a couple of days' notice, ramp up appointments, not do it by a walk-in basis, and all of that with a very fragile vaccine that requires cold chain attention and specific handling, and it's not easy. So I certainly don't fault anyone for trying to lead into it the way that we've seen, but I think this will give people the added predictability to help avoid that. Yes, sir.
So you and the governor both said that the people like advisors of Moderna are confident that it will still be effective on these new variants. What kind of tests have they run on new variants that makes them feel confident that it will still be effective?
At the moment, it's mostly been in vitro, which means laboratory tests, really, and it's primarily been the companies running lab tests against the variants or particles of the variant to see if it's a good match. That's usually the first step in this type of development. And of course, what we really want to see is population data. We want to see an area that has, particularly like the UK right now that has a lot of variant. We want to see exactly how effective it is, and we'll get that data in time. Most of the time, it follows closely with this type of laboratory data. It's similar to how we evaluate flu vaccines. The flu vaccine actually is a combo of a number of different strands every year, and sometimes it's a good match, sometimes it's not. So we feel encouraged in conversations that we've had with federal partners, particularly Dr. Fauci. He's encouraged as well. Perhaps a little bit less so for the Brazilian and the South African variants, although something about that is, even if it's not 94 or 95% efficacious, the way it is with the dominant strain, even if it's, I'm just going to make up a number, 70%, that's still significant. I mean, that's not something to disregard. So I think we're going to be in good place about that. It is certainly possible down the road that we might need to have a booster or an adjustment, but that's a small problem to have if it comes to it.
So even if it's not as effective, it'll still have some ability to some resistance. It'll still have some resistance.
That's absolutely right. And I'm talking now specifically to the Brazilian and the South African, because we do think the UK one's a good match. For those other two, even if it's not as effective as it is with the other strands, we do think it's going to be somewhat effective. So it's not all or nothing. Yes, sir.
We're getting a lot of calls at WWLTV about is the Department of Health working on a system where the average citizen can easily find what pharmacies are out and which ones have extra doses that are not being used. Are y'all working on anything with that?
We've had a lot of discussions about that, and the inventory does change quite quickly. The other end of that is a couple states have gone to a unified scheduling system, one number, and I tell you, I talk all the time to health officers in other states, and the feedback I've heard is when those systems work well, it's nice, but they oftentimes don't. And then when they go down for the entire state. I've heard twice now of states that have lost entire days worth of vaccinating because those systems went down. I talked to another state that is now on their third vendor of those type of programs because the first two didn't work that well. So we're trying to balance those decisions and do something that's more robust. So I think the jury's still out, is the answer to that. Great. Listen, again, it's encouraging that we're going in the right way, the right direction on cases here, but as the governor said, this variant is circulating. It's circulating a lot more than we're able to see. So we have to do everything we can now so that we are able to mitigate the increased spread of that when it does come our way. So thank you, everyone.
Thank you very much, Dr. Cantor. I do want to remind everybody to please download your COVID Defense app. This is Louisiana's new exposure notification app. By adding this free app to your phone, you can help protect your friends, family, your community from COVID-19 by getting alerts that tell you if you've been exposed. We announced this last week. No personal information is required to use the app. It never tracks your location. There have been more than 30,000 downloads of this app in Louisiana since we launched it last Friday. You can download the app from the App Store or Google Play and visit coviddefensela.com to learn more about it. So for many months now, I'm guessing close to 10, you've heard me saying many of the same things over and over. And I know you're tired of hearing it. I'm tired of saying it. But it's important that we continue to say it and continue to hear it, and hopefully more and more people will actually do the things that we're talking about. And I'm talking about wearing your mask, social distancing from those who are not part of your household, washing your hands frequently, staying home when you're sick, protecting the vulnerable, and now get the vaccine when you're able to do so. These things remain critically important. And while we're spending a lot of time talking about the vaccine, the simple fact of the matter is the supply does not meet the demand. There's not a vaccine dose for everybody who wants one. There is a mask for everybody who needs one. And that happens to be everybody. And anybody in our state who wants to be a good neighbor will wear a mask. It is really that simple. And by the way, it does confer a benefit on the wearer as well. So you protect your own health when you wear that mask. So we'll have our media briefing next week on Thursday. If we need to get with you all sooner than that, for some reason, we will let you know. And at this point, I'll take a few questions. Yes, sir.
This might be a question for Dr. Cantor, but do you have an updated number on the number of vaccines that have been spoiled and weren't been able to use?
I do not. I'm going to let Dr. Cantor have that one.
You missed your opportunity to ask that a minute ago. It's 295 as of this morning, which, look, that's a shame. In the grand scheme of things, we have about 400,000 administrations so far. So it's a small number of that. But again, we take every one of those to heart. The majority of those have been small numbers, 1, 2, or 3, because a vial dropped and cracked, or someone made an honest mistake when they were diluting it. They had a couple left over that got spoiled. We had a handful that came out of temperature when they were being transported. So, we do our best job when these happen to go back and, really do a full review and find out what the cause was and how we can address it and make it a more robust program going forward. And the biggest thing we've done so far, I think we mentioned before, is we've looped with the Public Service Commission to ensure that utility companies can prioritize the areas that have vaccine to minimize any power disruptions they might have. And we think that's going to be really good. There's been some states that have had large numbers, 4,000 in Maine, a large number, a number of thousand doses in Michigan, I believe. We've had nothing of that magnitude. So we'll keep updating you, as it comes in.
Next question? Yes, ma'am.
Governor, do you have concern about that 26% number of nursing home staff? That seems really low in terms of interest in the vaccine, even if it improves somewhat.
No, we are concerned. I can tell you, and this is somewhat better news, but it is also somewhat anecdotal and limited. I have better visibility into that at our war veterans homes, and I can tell you that the number of staff who get the first dose on the second visit by CVS or Walgreens is more than twice as many who got it on the first trip. And if we see that across the state at other nursing homes, that's going to go a long way to getting everybody or enough people vaccinated. So I'm somewhat gratified by what we're seeing at our war veterans homes. I don't have that level of visibility yet into the other homes, and they're just now starting, as Dr. Cantor mentioned, their second visits to nursing homes in Louisiana. By the way, the first visits to a few assisted living centers are actually starting now as well. So that was the second step in that long-term care partnership. So that is starting and as we speak as well. And so I am somewhat gratified by what we're seeing in our war veterans homes with respect to the question that you asked. And I do encourage everybody to have confidence in the vaccine, to get it when you're able, and certainly it is eligible to those individuals. And with respect to the question about what happens to those staff or maybe some residents who don't get it during the course of this long-term care partnership, just like we haven't turned off Phase 1A as we got to 1B Tier 1, we're not going to turn them off either. And we will make sure that they have opportunities to get the vaccine. But we do encourage you to get it now, but because time is of the essence, and it's never going to be more convenient than when we send CVS or Walgreens to your place of employment and they make it available to you and they give you an opportunity to schedule your second dose at the same time you get your first dose. It's never going to be more convenient than that for these people, and because time is of the essence, we're encouraging them to do it now. Yes?
Based on the numbers, it seems like there's going to be leftover doses in this program, right? And what happens if they're done making their visits and we have tens of thousands of leftover doses? Because right now you have a huge gap there. What happens to those doses?
We claw them back. Those doses are allocated to Louisiana. We don't get them because they go directly to the long-term care partnership. But to the degree that that partnership doesn't administer the doses that they have, we will claw them back. The other thing that we have done, and we've done this for 2 or 3 weeks in a row now, is we have prevented them from getting the full allocation they requested because it didn't match up with the speed with which they were delivering the doses. And we didn't want any doses sitting on the shelf anywhere that could be going into the arm of someone in Louisiana. So we have tried very hard to match the number of doses that are actually going to the long-term partnership, long-term care partnership. I don't know why that was so hard. With the number that's actually getting put in people's arms. And if we ever detect that they have been oversupplied and won't deliver those doses, we'll get them back.
What's the total number of doses you think they're going to need? Do you have an estimate? And how many have you held back from them so far? Do you know?
I don't know right now, and I don't know whether Joe can well, I guess Joe can tell you. He's got all the information. But how many we need is going to depend on what the uptake is. And it is impossible with any precision to stand here and say we know that once all of our visits are made, they call them clinics, first and second clinics to the nursing homes, and first and second clinics to the assisted living centers, that these are the number of doses that we will have administered, because we don't know how many of those residents and staff ultimately will participate. But I think we can tell you how many we have withheld from the allocation that the partnership wanted to date, if you've got that information.
So We think all told the partnership, and again, it's not just nursing homes, that's just the first part of it. It's also assisted living and group homes and other facilities. But we think all told, about 116,000 estimated is going to be the total number of people. So that's the total number of first doses. So, I mean, it is logical that we'll have to contribute some more than we've contributed already to that. But as the governor said, we're certainly not going to do that until they get much closer to the balance that they are. And that's just first doses. There's just, commensurate number of second doses behind that.
When you say 69% resident uptake, that's of the people who have been offered it so far. The places, the clinics have happened. There's still people out there who haven't yet had the opportunity to say yes or no.
That's right. Of the about 240 nursing homes that have been visited to date, of those residents, 69% has been the uptake rate.
But on that 116,000 number, that's the full population that could get vaccinated. That's not necessarily the full, that would, if everybody in that group wanted to get vaccinated, that's the full number?
It's not exactly. It's an estimate that Operation Warp Speed and the CDC puts out, and that estimate gets tighter and tighter as experience with the program goes on. So they actually are trying to project, both on statewide and national experience, what they think the uptake is going to be. So it's going to get more accurate day and day, but it's a general ballpark. I think when this program carries to fruition, we'll probably end up contributing more doses to it than we've paid in now, at the end of the day.
Couple more? Yes, sir.
Shifting from vaccines, some other the big news that we're following. Your stance kind of on that new moratorium on oil and gas leasings by President Biden in places like the Gulf of Mexico, the potential impact it could have on Louisiana workers and our economy. Do you have a stance on that?
Yeah, obviously, we're concerned about any moratorium like that that could adversely impact our state or the energy security of our country. And we are talking to different folks in the industry right now to try to figure out what that impact would be. There are a number of leases that have been stockpiled over time. And so, quite frankly, the one-year moratorium on the leasing, other than some revenue that would come to the state, for example, as a percentage of what that lease revenue would be, that's going to have an impact on us. But in terms of what happens over the course of the year, if they permit the drilling activities on leases that have already been obtained, then the impact will not be as great as it otherwise would be. And we're trying to figure out exactly what all of this means. As you know, it all happened in the last couple of days, and we are talking to our partners, and I'm looking forward to engaging with the Biden administration to make the case for continued leasing and exploration production in the Gulf. Yes, sir.
Would having the new strains in the state make a difference in terms of your decision for mitigation measures? I realize a more communicable virus could lead to more cases, but I'm wondering if it would bring any additional factors other than the gating criteria you're using.
Well, to the extent that it increases test positivity and cases and hospitalizations, those are the gating criteria, and so the answer is yes. Based on the 3 confirmed cases that we've had right now, no, and I haven't been given any guidance from the Office of Public Health with respect to that either, and neither has anything come from the CDC or the White House Task Force, and I'm not sure they call themselves the White House Task Force anymore, whatever. There is a COVID group working out of the White House now. It's not called the White House Coronavirus Task Force, I don't think. But we haven't received any information like that that we should tighten up our restrictions now because of those variants. And in fact, we are somewhat heartened to see that the trajectory that we were on is much better today. We've at least plateaued. Perhaps we're seeing improving numbers over time. The most alarming thing is just the sheer degree of disease burden in our communities. The amount of COVID in our communities continues to be reflected every day in the cases and the positivity. The number of patients in our hospitals really, really high. And sometimes people do focus on whether you're getting worse or you're getting better. And we need to be paying attention to those things. But you also have to look at where you're at. And if you are getting better, but still at a very, very high level of community spread, then that has to factor into the decisions we make about what is reasonable in terms of the behavior that we engage in our work environment and with our family, with other activities that we engage in. And that's why these mitigation measures are as important, or perhaps more important today, than they've ever been. And I understand that people are tired of them. But again, the virus doesn't care. Particularly these new variants don't care. And so we just all have to do better. And it would be a shame to get to where we're closing in on the date, I believe, when we're going to put this pandemic behind us. And more people are going to have the vaccine available to them as we move forward. And as we get closer, it seems to me like it would make sense to do everything we can to prevent contracting the disease, just because we know we have less time to go now than we did last March when all this started. So I'm asking the people of Louisiana to be more diligent than they've ever been right now. Well, I want to thank you all again for your continued coverage. It is incredibly important, the information that you all put out to the people of Louisiana, and I thank you for what you're doing. I also want to encourage the people of Louisiana to choose their sources of information wisely. This goes back to some of the myth-busting that was done by Dr. Cantor today. These were just some of the myths that are more prevalent. There are so many things out there that are spreading around, and I'm just encouraging people to go to the FDA website, go to the CDC website, go to authoritative sources to get information, and so that you can make truly informed decisions about what is in your best interest and the best interest of your family or your business and so forth. And let's all pull together. Let's continue to pray for one another and work together as we always do in times of crisis in Louisiana. Be good neighbors to one another. And right now, it is still the case, unfortunately, that we can show one another how much we care for each other and how much we love our family members and so forth by doing those things that are required. We wear our mask, we social distance, we wash our hands frequently, we stay home when we're sick. Outside is always safer than inside. All of those things still matter. And those people who have been more vulnerable to this disease over the course of the last 10 months, they remain more vulnerable to this disease. The deaths we report every day are still comprised of the same groups of people, primarily older folks and those with those comorbid health conditions, but not exclusively. We still have young people and people who apparently were in very, very good health without any known comorbid health conditions who have very serious cases of COVID-19 that require hospitalization and quite often result in death. So this is a very serious situation. And so let's all do our part and get through it in the best possible shape and in the shortest amount of time. We do that by following the mitigation measures and getting vaccinated. So we'll talk to you next Thursday. Everybody, please have a safe and nice weekend this weekend, and remember all the things that we've been talking about. Thank you, and God bless.